Hey everybody, welcome back to the show. I can't wait to get into today's topic. You know, one of the biggest things that I myself as an integrative health practitioner, doctor of naturopathy, really has to see in my practice that's so disheartening is that when I meet with a new client and they've been on a medication for 5 years, 10 years, maybe even longer, and you can see what it's done to their body. And one of those that I want to talk with you here about today are stomach acid reducers or blockers. The detrimental effects that these have, short-term and long-term, can't be overstated. They really can't, especially when the packaging says this product is not meant to be used long-term. But since doctors, medical doctors, do not have another way and able to help their patients to reduce stomach acid and acid reflux and GERD, they keep them on them because you know what? The medications mask those symptoms. They do reduce stomach acid. The problem is there's so many ill effects that happen downstream and the client or patient doesn't even know about it because as far as they're concerned, I take this pill, right? I'm not going to name any names, but they take the pill and then all of a sudden, magically, they have no more stomach acid. But they're never told how detrimental it is to not have stomach acid in the first place, right? That's a huge problem. And they're also never told what happens if you don't have stomach acid. Your body, you know, when our humans were made, they were made when they needed. And you need stomach acid, right? You actually need that to digest protein, to be able to absorb certain vitamins and minerals. Without it, it's not happening. So I want to go over some of the short and long-term side effects here today. And then of course, not just leave it at that, but give you an action plan as to how you can rebalance your gut. And I'm going to go through this fairly concisely because I want it to be it can be listened multiple times, but I really want you to work this process. All right. So the short-term side effects are usually digestive-based issues with going on PPIs or stomach acid blockers, reducers, whether it's over-the-counter or prescription medications. So a lot of people get nausea or vomiting, or they feel bloated, or they start to get gas, or alternating constipation and or diarrhea. Sometimes they get headaches, could be migraines, but oftentimes just kind of headaches, fatigue, and overall dizziness. Now, this is in the short term. It doesn't mean within an hour of taking it. It means within weeks, right? Because more chronic long-term would be after 6 weeks. Skin reactions can be rashes and or itchy or tingliness. And we talked a little bit about that on Tuesday, and that wasn't even one of the topics that we brought up, but possible medications for sure. And then respiratory symptoms, sore throat, or just kind of a random cough. Why the random cough? Well, there's a little bit of acid there. The lower esophageal sphincter hasn't been closed, and you're kind of coughing, clearing your throat. A lot of that is silent acid reflux. Can't feel it, right? It's there though, because you're taking the acid blocker, but you are not closing the muscle at the bottom of the esophagus where it meets the stomach. So the stomach, what little acid is still there, still continues to come up. That's why people long-term on acid blockers can often have cancer-based issues of the esophagus. So I just to give you, obviously, a disclaimer, I can't provide any medical advice, medical treatments, medical cures, and medical diagnosis, but important that we talk about this all-important topic. All right, so what are some of the long-term consequences of being on these acid blockers or acid reducers? The biggest ones, well, I shouldn't say the biggest ones, this can happen within 4 weeks, is you can actually become nutrient deficient. What nutrients? Well, very specifically, and again, modern medical science knows this. You can type this right into PubMed. Like this is not, natural health does not have a different form of science than allopathic health, which is your conventional medicine doctor. We use the same science. I like to use all of it, right? However, allopathic science only likes to use part of it, right? Because that's the way in which they work, which is a pill for every ill and masking the symptoms. They provide sick care. We try to provide health care. That there's a huge difference there. But the ones that have always been known are essentially your B vitamins and mainly vitamin B12. B6 is one part of that, but B12 is one of the biggest ones. You need stomach acid to be able to digest, break down, manufacture B12. Here's part of the issue. What if you don't have enough B12? Well, it can lead to anemia. A lot of people think that anemia is just iron. No, it's not. That's only one part, right, for anemia. It can lead to fatigue and neurological problems. Another big one is magnesium. Without stomach acid, you're most likely magnesium deficient. It can lead to cramps and headaches, irregular heartbeat, weakness, poor energy production. And then calcium. Well, eventually you can end up with osteoporosis, right? That's not ideal, and bone fractures, etc. But calcium's needed for so much more, hair, skin, nails, etc. All right. Long-term use of PPIs and stomach blockers is increased risk for infections, specifically because your immune system is thrown off. All right, there's a couple ways. If we don't have stomach acid, we can't block bacteria and parasites and pathogens from coming into the body. Remember, your acid in your stomach is the first line defense for bacteria in the food, from mycotoxins on the food, right? Mold, and from, as I said, parasites, pathogens. So you can get Clostridium difficile easier. You can get SIBO, small intestinal bacterial overgrowth, because you need acid in order to be able to produce bile. And so oftentimes there's slower bowel motility. And so bacteria can begin to build up. So all sorts of digestive issues happen, eventually leading to, as I said before, inflammation with the bloating, the gas, the cramping, etc. There can also be rebound acid reflux. This is the hard thing with clients. As they have to work with their medical doctors, but as we start to wean off, as we begin to rebalance their body and they work with their medical doctor to wean off, there can be a rebound in acid reflux. That's one of the biggest challenges. That's why people have such a hard time coming off them if they've been on them typically for years, not just months. And that's a real problem, because now we get more stomach acid secretion than ever before. And so we have to use things like Healthy Belly with deglycerinated licorice root, not regular licorice root, DGL, in order to be able to help with that. Marshmallow root. We use a product called Healthy Gut Support. So really, really important. All right. Long-term use can also lead to chronic kidney disease. Please do see my podcast on chronic kidney disease. It is so much more common than you would think. And obviously a horrible way to live out your later years. And then a couple others, which would be cardiovascular risk. Cardiovascular risk, look up long-term PPI users or long-term acid blocker use and cardiovascular risk, which means heart attacks. And you will see that there's increased risk for heart attacks and cardiovascular issues in long-term acid blocker users. And that goes for stroke as well. So stroke, cardiovascular, keep in mind, those are the two leading causes of death. And you can say, oh, it's just part of old age. That's why people die of heart attacks and strokes. There's so many other reasons. And believe it or not, which is awful, they do not tell you that. That is an increased risk when you're taking these PPIs. All right. The last one is gastric polyps and potentially increased cancer risk in the intestines. We talked about the inflammation. We talked about the imbalance in stomach acid to bile. We talked about the increase in potentially parasites and or bacteria and candida. And potentially with that increased inflammation could lead to gastric polyps and stomach and or intestinal-based cancer. So these are all things that none of us want. I understand that, but you might be on a stomach acid blocker and saying, I need these because if I don't use them, I literally am, my throat's burning all day long, and I get it. So the first thing we like to do is run the Big 5 labs, or maybe just the gut bundle. And those are 3 labs, and that's just for your digestive system. But either way, you want to say, okay, what are my imbalances? And that's one of the biggest places to start. Then after that, typically you're going to do what's called a 21-day functional medicine detox, and then move into the CBO protocol, which rebalances the gut. But I don't want to give you something that your body may not necessarily need. And so what we try to do is go to stephencabral.com/big and the number 5 to run the Big 5 at-home lab tests. You don't have to run them with myself or my team. You can actually run them with any integrative health practitioner level 2, or with a licensed naturopathic doctor in your area. That would be fine as well. So whatever works for you, works for you. But you want to get to the root cause, because there's always a root cause. It could be, I've got so many shows on acid reflux. So go to stephencabral.com/podcast, type in acid reflux. You'll see a bunch of shows. If you can't find the show you're looking for, just go to cabralsupportgroup.com. Say, hey, I'm looking for the podcast on acid reflux and how to get off PPIs. And our amazing team will send you over the links to those shows. Because remember, there is always an underlying root cause. Sometimes it's a hiatal hernia. Sometimes it's actually low stomach acid production. Sometimes it's a lower esophageal sphincter issue. Sometimes it's poor food, I shouldn't say just combining, but poor food-based issues you're taking in. There can be a lot of issues. We want to help you solve that. So all the show notes from today will be at stephencabral.com/3352. But also, don't leave it at that. Let's start to take action as to what we can do to begin to rebalance the body. Best thing you can do is actually find out what your deficiencies and toxicities are. Next best thing you can do is to run the protocols that we've seen work in the majority of people, which is start with the 21-day functional medicine detox, and then move over to the CBO protocol to rebalance the gut using those nutritional plans. And then if you can, even better, running the labs, working with a practitioner that will guide you through this process. But however we can help you, please let us know. That's the truth. So ask the question at cabralsupportgroup.com, leave a comment below, let us know how we can help. It's all about helping each other because allopathic medicine is not going to. They're going to give you a pill for every ill, mask the symptoms, and trust me, there are deeper underlying issues that you want to take care of, even if you have to take the pill for a temporary, period of time. Okay, temporarily, and then you begin to wean off with your medical doctor, and you'll be able to solve this issue. Then you'll be healthy for the rest of your life, and that's really what it's all about. So let's head on over to StephenCabral.com/3352. We can link up the labs. We can't link up any products, but you can always find the products that we use in our practice at StephenCabral.com/shop. Have an amazing day, everybody. And as always, if this was helpful, do feel free to share with anyone you believe it could serve. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything. Functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.